But, whether we're officially responsible for, COVID vaccine outreach or we're just communicating our policies with organizations and with the people we work with, we're all kind of in this, like it or not, COVID communications. So I thought maybe we would just go around and introduce ourselves, and then I'm going to introduce our speaker, Anand, who is our speaker, but he's actually one of us. He's a comms for good guy. So, all within the family. Anyway, so why don't we just go around and, say your name, where you work, and maybe if you have a kind of a good idea, a COVID adaptation that you've heard about that you think was pretty cool. So I'll start. I'm Jennifer Amder-Spitz, the Amder-Spitz and Associates. I'm based here in Chicago, and we do strategic communications with nonprofits and foundations. And so that, as I said last night, I went to an in-person event, which was really awesome. And what they did was they sent out this, it was kind of like an official link that they sent out, and you had to certify ahead of time that you were vaccinated. And so, you filled that out and you sent it back. And that way they just kind of got that out of the way, and there wasn't any like gatekeeper at the door. They just, everybody who was invited, who RSVP'd, had to fill that form out. And I thought that was pretty good way of handling that. Let's just go around. Lynn, do you want to introduce yourself?
Sure. Thank you, everybody. My name is Lynn Hazen. I'm founder and president of Lynn Hazen and Associates. We're an executive recruiting firm and have lots of jobs related to medical communications, med ed, PR. We have lots of jobs and not enough talent, believe it or not. We have fussy clients, so they're looking for very particular skill sets. I have a funny story that's kind of weird. I went to a COVID conference in person a few weeks ago. I'll leave out the name of the organization. We had to be certified. So I had to go back and go get retested, even though I had all my certificates. No one checked at the door though. I had my certificate. I had proof that I had been tested, and yet no one asked. So I don't know if they assumed that everybody there, being scientifically inclined people, where everybody was wearing their mask, but no one checked, which I thought was bizarre. But criteria to attend was that you had to be tested. So I thought, why don't you just close the gap and double check when you register at the door? My 2 cents. Next.
Jamira, you want to go next?
Sure. I'm Jamira Alexander, the president and executive director of Public Narrative. We've been around for 32 years. We are a media literacy and communications resource here in Chicago for nonprofits and connect them with journalists. So I've been attending a lot of in-person events lately, and the same, Lynn. There's all these qualifications to start, but there is no like requesting to see our vaccination cards or test results or anything of that nature. And the one thing I have seen, one event I attended, there was food, but there wasn't food during the actual event. It literally was like a grab and go. So they had like snacks as you were on your way out the door, and they weren't snacks where like, you had to touch handles and all those kinds of things. You literally could just grab it and go. So that was pretty cool to kind of keep us safe. But again, like that double checking at the door, I think is really huge if they're going to have such, strict criteria to even go.
Good. Brenda, do you want to introduce yourself?
Sure. Hi, everybody. Yes, Brenda Berman. I have my own business called BB Communications. Soon to join the Carol Robertson Center for Learning as their Director of Marketing and Communications, which I'm very excited.
Congratulations.
Thank you. I understand, if you could give me, I'm sorry, I came in late. I understand the question is about if you've had in-person experience at events recently and what their protocol has been for checking your.
No, it was just name, organization, and then if you've experienced an innovation in COVID, related, safety that you think was interesting?
I haven't really, I'm sorry to say, because I have not actually, I've been slowly venturing back into in-person events, but really slowly, and including one this last weekend, which was a very small film festival. And there was no protocol there whatsoever, but so no, I don't, sorry.
Jay?
Hi, everybody. I'm Jay Janeski. I'm the Chief Comms Officer for the Institute for Citizens and Scholars, which used to be called the Woodrow Wilson Foundation. Have experienced no innovation. In fact, I've actually mostly experienced confusion and some concern about anything COVID related in the events. But our organization actually does a lot of convening of our fellows, of policymakers, et cetera. And so we've been obviously dealing with a lot of the tackling of how to do that, how to communicate that better, how to provide more real-time communication about what's actually going on and all the different contexts around states and regions. So I'm super jazzed to be here today and hear what we have to hear. Thanks.
Thanks, Jay. Laura? You're muted.
I turned video, but not microphone. Good afternoon. My name is Lauralanteros. I'm a data scientist and analytics engagement manager for a small consulting firm in the DC area. We work with a lot of government agencies. And in terms of COVID, I haven't seen too much. We've been facing a lot of the mandates where contractors have had to go into the building throughout COVID and be masked and all that sort of stuff. So it's affected, I guess in some, like we haven't been able, not everyone's been able to work from home. You know, they've had to either not work or go in on an alternate schedule. And so I think it's, you know, sort of just as a different perspective on setting policies and communicating about it, because it sort of takes away people's ability to work.
Kareem, do you want to introduce yourself?
Yeah, sure. I'm Kareem Alston. I work with the Communications Network and help with the digital events and engagement. I, like Jay, I don't think I've seen a lot of innovation. I live in San Francisco, so the vaccine card at the door seems like a pretty good policy, but depending on where you are, I know there's a lawsuit in New York where my family's from, where there's a half church, half comedy club. And when it's church time, they don't check vaccine cards, but when it's a comedy club, they do. And so the lawsuit's about, well, if they're allowing people in without vaccines at some times, they have to allow them at all times. And I'm very curious. I know New York, specifically NBA basketball is going to start and everybody using the gym needs to be vaccinated, but some of the biggest stars aren't. So there's going to be something's going to happen with that, and we're waiting for the shoe to drop. And I'm curious to see what innovations come out of that, you know, or whether that's an incentive for people to get vaccinated. Happy to be here.
Allison?
Yeah, hi, I'm Allison Gross. I'm the Director of Strategic Communications and External Affairs at NORC at the University of Chicago, which is a nonprofit, objective, nonpartisan research institution. And that I'm focused on, it's our 80th anniversary in October. But I wouldn't say I've seen innovation, but I will say that COVID communications and messaging has pretty much taken over my life for the last however many months, because in my role, I work with both our internal communications, as well as our external communications. So our fabulous researchers have done amazing research around COVID in all different areas, and we've been communicating around that, including some around vaccination. And we've done some contact tracing work for Maryland and Delaware in particular. But I think the most challenging is our internal COVID vaccination communications, because we have kind of what I would describe as some multiple workforces. We have our kind of central office workforces, which are our researchers and our administrative staff. We have 3 main locations for our telephone interviewers, and they are at a very low vaccination rate. We have one, our hub is in Chicago, Albuquerque is another one, and Wichita, Kansas. So you can imagine what's, the different states, the different locations. And then we also have field interviewers where their job is to actually knock on people's doors, go into their homes and interview them. And that, of course, has been mostly put on hold. And they've pivoted to combination phone and web, but there are some of them who are now doing some in-person data collection and setting them up for success and making sure the respondents are comfortable with what we're doing has also been challenging to make sure everyone's comfortable. So I've got a lot of questions that I'm really looking forward to learning from you, Anand, and from talking to others, because we've got some challenges.
Well, thank you. So we were just joined by Hilary. Hilary, do you want to just say your name and where you're from?
Hey, good morning. My name's Hilary Fish. I'm from Natividad Medical Center in California. I got referred here from our community foundation.
Excellent. Well, thank you for joining us.
Thank you. Sorry, I'm a little late.
That's okay. We're just about to get started. So, as we all know, vaccine communications info is changing like all the time. And it's, it's challenging to keep up. And, whether you're trying to convince people to get vaccines, which is some of our jobs, but not all of us, or, tactfully trying to communicate your vaccine policy, we all are kind of like on this dance floor, whether we like it or not. And we're just trying to figure out how to do the best we can. So ComNet Chicago has invited Anand Balasubrahmanyan to share some insights with us. Anand is the communications manager for the Chicagoland Vaccine Partnership. That was incubated at Michael Reese Health Trust, which kind of took the initiative to organize the Chicago Vaccine Partnership. And it has really broad participation from a lot of the foundations here. And it's funded by the Health First Collaborative. So a group of regional foundations formed the Health First Collaborative last year to respond to the twin pandemics of COVID-19 and racism. So the collaborative invests in community-led kind of innovative solutions that address the root causes of racial health inequities. And it currently supports 2 different hubs of initiatives that aim to redefine existing public health systems. So the first hub works with community health centers as partners in health transformation. And then the second hub focuses on equitable vaccine education and outreach through Chicagoland. So we're going to hear about the Chicago Vaccine Partnership from Anand and their work to disseminate kind of trusted, accurate vaccine messaging in the region. And then we're going to open it up for a Q&A with Anand and also for us to just kind of have a conversation with one another and share our, what we're finding that works and ask each other questions. So with that, I'm going to turn it over to Anand. And if just those of you who joined late, we are recording this session so that we can share it up on the website. And Anand will share his slides afterwards as well. Take it over, Anand.
Yeah, of course. Thanks so much, Jennifer. And it's great to meet everybody. As she mentioned, I'm the communications manager for the Chicagoland Vaccine Partnership. I've got a PowerPoint presentation sort of about who we are, some context about COVID and vaccination in the Chicago area, and sort of our approaches to communications, both in terms of trying to get people vaccinated, but also keep organizations, abreast of what's going on. While I'm sharing my screen, I do just want to say that we're a small group here. So if you guys have questions, feel free to interrupt me at any time. I'm happy to turn this more into a conversation as opposed to just me talking at you. But give me 1 second here while I share my screen. All right, so the Chicagoland Vaccine Partnership. We're a coalition of over 135 different organizations in sort of the Chicago and suburban Cook County area. We include the public health departments, the city's public health department, the county's public health department, a lot of local funders, but the majority of our members are community-based organizations. So people who are sort of on the ground trying to get their communities vaccinated. The photo here in this slide is one of our community partners doing sort of door-to-door canvassing around vaccination in the Englewood neighborhood. And our approach here is really twofold. Like in the short term, we're trying to get people vaccinated. So that means increasing access to the vaccine, mobilizing community members to get vaccinated or to talk to their neighbors about vaccination. But also our longer term goal is to sort of use this moment where there's a spotlight on public health, and in particular, who the public health system doesn't reach. You know, in Chicago, that's the Black community and the Latinx community, and sort of use what we can learn about COVID vaccination outreach to change how the public health system works so that it reaches more people. Here's a slide. It's just some context about kind of health disparities in the Chicago area. You can see this graphic to the side was actually created before the pandemic, so it doesn't even include deaths that happened because of COVID. I think it came out in January 2020, but it shows that there's just a significant life expectancy gap in Chicago depending on where you live. And Chicago is a pretty segregated city, so where you live is often a code for what your race is. So you can see here, you know, if you're living in the Loop, the average life expectancy is 85 years. That population tends to be pretty white and pretty affluent. But if you go just 8 miles to the south, like 7 stops on the L to Washington Park, the average life expectancy is only 69 years. And that's a largely African-American community. Southwest area, it's a little higher than Washington Park, but it's still much, much lower than the wider parts of the city. And same with the west sides that are sort of majority Latinx there. And, you know, the reason why I like to show this slide is that COVID hit, you know, communities of color in Chicago the hardest. In particular, you know, the Black community had the most deaths and the Latinx community had the most total number of cases. But if you were to look at almost any health issue, you would see that those disparities exist there. So, you know, kidney disease, diabetes, heart disease, gun violence, you know, everything that sort of affects a person's health hits those communities more. And it's just sort of shows that there's a public health system that is just clearly not reaching everyone in the city. And so here's kind of an update on vaccination efforts to date in the city. You can see that for the Black population, 40% have completed the vaccines. And for the Latinx community, that's just under 50%. Again, sort of showing where the healthcare system doesn't reach. This map on the side here, all of the neighborhood areas that are in blue are areas where vaccination rates are above 50%, but those areas that are not colored in are all below 50% in terms of vaccination. And with Delta spreading, you know, that's just a very risky situation. And so, you know, what we're trying to do as the partnership is really kind of expand access to vaccines and also increase the number of people who are out there sharing good information about where people can get vaccinated and why they should get vaccinated. You know, I think part of the reason why you're seeing the numbers here and the numbers here is that, you know, a lot of people in the south and west sides of the city just don't regularly interact with the healthcare system. And so you need to sort of create new messengers that can help explain, you know, where and how people can do that. So we try to mobilize community leaders to talk about vaccination, where people can get vaccinated, educate people, and that includes, you know, leaders for organizations about like what's the latest going on with COVID, you know, what's up with the J&J pause, what's going on with the Delta variant, vaccine mandates and equity, those sorts of conversations. And then finally, we're really trying to elevate coordination between the public health system and community-based organizations, because there's a lot of organizations that are doing work in the communities that are hit hardest by COVID, but they're not a part of the health system, which is a little problematic at the moment. So a few of the activities we do, this is one of our big ones. We have a weekly gathering, a weekly convening, where, you know, we tend to have around 100 people at each of these meetings. And it's just the city's public health department and the county's public health department present the latest COVID statistics, sort of where it's spreading. And they also present about vaccinations, where it's happening, where it's not. And then the majority of the people who attend these meetings are actually from community-based organizations. And it gives them a chance to sort of raise barriers that they're seeing directly with the public health system. And also to say, you know, I'm getting this question from my community a lot. How do I answer it? Or I'm having trouble bringing vaccine buses to an event. Can you guys help me navigate it? And so it's kind of a weekly area to problem solve around COVID. And with the way that information around this disease changes so frequently, we found that to be actually one of the more effective ways to communicate. We have a vaccine ambassador course.
Can I ask a quick question?
Yeah, go for it.
When you have these meetings, are they in person or Zoom?
They're on Zoom. They're on Zoom. And I mean, that's partially because we started them, around December 2020 or January of this year. And so it just wasn't possible to meet in person, but it just makes it easier for everyone to be able to attend. And yeah, when I share the slides after this program, there's a link to register to join. Like anyone on this call is welcome to join to get the latest information. We have this vaccine ambassador course. We partnered with Malcolm X City College to create an online free course that people could take to learn about the disease, the vaccines, and most importantly, how to have an effective conversation about vaccination with people in your network. You can get college credit for taking the course, and we've had over 3,000 people sign up for it. And we also provide support through a learning community to people who have taken the course to make sure that they have the most up-to-date information. We've got a speakers bureau where we have a lot of medical professionals, particularly ones that speak languages other than English. And community organizations will reach out to us and we'll provide a medical professional that, you know, meets the demographic needs of whatever that community event is to speak at it. And so, you know, they'll speak at any event. There have been town halls, there are church meetings. The image on this slide is actually from a Zoom cupcake baking class where while those cupcakes were in the oven, a doctor answered questions from parents and kids about vaccination. And so really we're just trying to get as many people you know, to wherever there are gatherings possible so they can talk about vaccines and vaccination. And then the final thing that we do—
Can I ask a question?
Go for it.
Sorry, Anand. You said we could jump in.
Oh, yeah.
So I'm just thinking about if a company had staff members who were members of the communities that you serve, and they're vaccine hesitant, and the company is trying to get more folks to take the vaccine. Would there be an opportunity there to maybe have some connection or some way to have somebody come and speak by maybe somebody who would be more trusted from the partnership to the staff or members who are resistant? I'm just kind of curious. I have no idea if it would work or if anyone would go for it, but.
Yeah, definitely. You know, we have this roster of speakers, and it's really just about the company sending a request and seeing if we have someone that is available at that time. You know, a lot of these medical professionals are sort of volunteering their time. But yeah, you know, if you have a company where there's like a lot of Spanish speakers, you know, one of the things that we're seeing that is a huge barrier to access for the vaccine right now is people aren't able to get time off of work, right, where they can get vaccinated. And so, yeah, you can reach out to us and we're happy to try to connect one of these speakers with the organization. Most of the people in our speakers bureau, though, are geared towards populations that, you know, speak English as a second language, and that's kind of the focus of this program.
Thanks.
And, yeah, of course. And yeah, the final thing we do is community mobilization grants. So we've given a little over $1 million to community-based organizations that you know, are trusted in their community. Frequently, they actually do have a big impact on the health of their community, but they're not a part of the public health system. So what I mean by this are like food pantries, right, or affordable housing providers, violence prevention programs, you know, organizations that are really in the everyday lives of people from communities that have low vaccination rates in a way that the health system isn't. And so, you know, organizations that people would really trust for information about their health. And we're basically just giving them grants that are extremely flexible and saying, design your own outreach and, you know, let us know how you would reach your community best and just go for it. And so a lot of these organizations are putting on vaccine events, or they're incorporating information about vaccination in their regular community outreach and canvassing. It's really interesting to sort of see what these organizations do, but it's all a part of a broader vision of sort of expanding the organizations that are involved in public health so that the health system actually reaches communities of color. All right, so final few slides here are just resources. So things that your organization can do to improve vaccination rates. You can bring a vaccine to a community event. When I share these slides, all these links work, but the city has like a mobile vaccine bus that you can request for an event, and you can fill out a form for that. You can become a vaccine ambassador, take the course, and start having conversations with people. And honestly, that has been the most effective form of vaccine outreach, particularly at this stage of the pandemic, where you have roughly 60% of the city vaccinated. And so the people who are remaining really tend to be a little more high touch. And the most effective way to reach them is have someone who they trust, like a personal relationship, talk to them and listen to their concerns about COVID and the vaccine. If you are an employer, we'd really suggest allowing employees to take time off of work to get themselves or their children vaccinated. Vaccination rates are lowest among the younger population. Partially that's because vaccines have been available for those folks for as long, but there's also a lot of resistance. And in a lot of cases, they need parental consent to get vaccinated. Mm. And so giving time for parents and students to get the vaccine is really important. There is an organization called Made to Save. They put on storytelling trainings that help people sort of tell the story of why they got vaccinated and prepare them to have these sort of interpersonal conversations with their networks. And so you can email that info@madetosave.org to try to schedule a storytelling training for your organization. We've found that those can be relatively effective. City of Chicago has an in-home vaccination program. It's really easy. You go to this website, you request in-home vaccination. They're offering $100 Visa gift cards for people who get vaccinated at home. And it's up to 10 individuals in a home, and each of those could get a $100 gift card. And so that's another incentive that's out there. And finally, if you'd really like, you could join a vaccine canvassing team. They do door-to-door outreach. I think that program is going to change a little bit when the winter hits, but it's still an effective way to get out there and talk to people. And because we're all communications folks here, here are some messaging resources. The CDC tends to have the most up-to-date messages. They've got myths and facts, a communications toolkit, some key messages. Those are all okay. The Interfaith Youth Core Vaccination Conversation Playbook. What I like this resource is that it's really aimed for having conversations with faith communities who in a lot of cases tend to be more skeptical of science and the medical community. So it's a good way to think about having sort of non-judgmental conversations. Same with the Public Health Institute's messaging best practices. That one really emphasizes listening and non-judgmental conversations and sort of accepting that when you talk to someone, you're probably not going to change their mind, but by presenting your case and listening to their fears, a person is much more likely to make that decision themselves to get vaccinated, especially if you let them know an easy way for them to do it. And then finally, there's this Frameworks Institute report where they did some research on vaccine messaging, and that's pretty interesting if you're putting together your own communication materials for your organization. All right, well, that's everything I've got here. At the very end, when we send this out, you can register for our weekly meetings and learn more on our website.
That's great. Will this slide deck be available to us as well?
Yeah, I'll send it to Jennifer and she'll share it out.
That's great. Thank you, Anand. That was, tremendous and an awful lot of information. So okay, Jay, your hand is up. Go ahead.
A question that's less maybe about the specifics of the work and more just like kind of like from a communications lens. How much are you leaning in the direction of solving for vaccination versus solving for long-term change within certain demographics, populations, et cetera. So like messaging around trust, shifts in narrative about public health, that kind of thing. I'm just really curious, like how you're making decisions on that front.
Yeah, right now we're really focused on just vaccine access and distribution. Like we kind of need to get to a little bit better place, especially before winter with vaccination rates. But our thinking is that by connecting people to the vaccines and sort of using money that's given to the public health system, particularly federal dollars, but the city is also dedicating a lot of money as well, and giving that directly to community-based organizations, you're sort of building the bridges to those communities for the public health system to continue to connect with them for the long term.
Thanks, that's great.
It's interesting. I get I live in Andersonville, so I get the online newsletter for Andersonville. I've never seen, and they do a lot of updating about COVID and shots. I have never, ever seen that list of like resources available on that website. Likewise, frankly, nothing in the Chicago Tribune, which doesn't surprise me. But by the same token, like, are you doing outreach to the media to get them to cover these resources that are available?
Yes. We do outreach. I mean, I hear this a lot. The city has a lot of programs that no one knows how to access, and that is an issue. The at-home vaccination program, I think the city is rebranding it as Pay It Forward, and they're going to do a large press announcement, I believe the week of the 27th of September. And so that's when that media push is happening. But for these other ways to get vaccinated, we have done press outreach, and we've been able to get coverage in a lot of like local outlets. So Southside Weekly, Block Club Chicago, the Crusader. We've gotten coverage there, but Tribune hasn't really touched this stuff. WBEZ did a really good story earlier in the pandemic, and media is just, it can be a totally like mercurial, who knows why they pick up a story or not. So we do a lot of pitching, but we also want to dedicate most of our communications time to preparing trusted messengers, because those people are really going to have the conversations that need to happen.
I have a question. I'm wondering on how you're going, how the partnership or the various folks are pivoting, or maybe expanding is a better term, to address the vaccine, the Pfizer vaccine being approved for younger kids, and in these vaccine hesitant communities and making those connections. Now you have to convince parents to get their kids vaccinated as well. And I'm wondering if you have anything you could share now, just sort of how you're thinking about tackling that.
Yeah, there's a subsection of our grants that are all sort of education world focus. And so a lot of them are given to after school programs or sort of parent associations. And we do provide those folks with messaging and resources about the vaccine. In terms of vaccines that are available now for 6 to 12-year-olds, I think that messaging, like that just happened. So we're still developing that. We're also trying to get a bunch of our members to basically put a list of recommendations together for the new incoming superintendent for CPS to just sort of say, like, try to make it as easy as possible for staff and parents to get vaccinated, and share the most up-to-date messaging about who can get vaccinated. But the schools are their own sort of unique environment in the Chicago area. And so a lot of times we're working with organizations that work with parents and students, and the school system itself has its own kind of communications strategy.
I'm just really fascinated by it and curious, and of course concerned. I may be giving away my age, and I'm from New York, so maybe this only happened in New York, but I remember very clearly being vaccinated in my elementary school gym for rubella. And I don't even know if my parents had a choice at that point, but I still remember it. And I'm like, I have this vision in my head, oh, if only we could do that, but it's a very different time.
Mm-hmm.
Well, I remember schools had vaccine campaigns when I was a kid too. I remember we used to get our TB test every year. Yep. And then there was also, there was a hepatitis C. Somebody had a case of hepatitis C and they just vaccinated all of us. There's no question. You just line up and go through the gym and everybody got a shot, and that's how they eradicated the Spanish flu. There was none of this vaccine hesitancy. They created these vaccine, outlets, and people went through and got their vaccines. And, that was a very successful public health campaign. I don't know. So I have a question for you, Anand. Maybe this is also my cynicism, but I feel like we're doing so much carrots, like paying people $100 to get vaccine. This is like so gentle and kind and like, here, do this for us. And it's like, what's the balance between carrots and sticks? Because like, I'm kind of like, look, if you don't want to get your kid vaccinated, then don't come to school. You have to do Zoom. Everyone who comes in these doors has to be vaccinated. It's like, where's the stick? Where do we say, look, this is not an option?
Yeah, what I would say is that operationalizing sticks can be very challenging. So the state of Illinois, right, does have a vaccine mandate for employees at schools. So that's teachers, janitorial staff, bus drivers. 10% of the bus drivers in the city quit when the mandate was enforced. There is a drop dead date, where if a teacher doesn't show a vaccination card, they would technically lose their employment. But like, what are the systems that are set up to actually check in with every single teacher to look at their vaccine card? Is every school going to fire all the employees at the school that haven't gotten vaccinated when it's already extremely challenging to find qualified teachers? I would say that mandates are an important part of a strategy to try to get as many people vaccinated as possible, but actually sort of carrying out the most like punishing parts of a mandate can be extremely challenging for organizations. And I think that's sort of why you're seeing what's going on in the way that it is right now.
Can I ask you a question? What's worked? I mean, I did see the article about people in their homes, and so I've seen like bits and pieces of it come through. If you were to say the most successful tool we have used is X, what would you say that is and why?
The most successful tool that we've used is training trusted messengers to have conversations with their families or their close community groups. And that's the big one. Mm-hmm. Putting on vaccine events, if you're doing that, a best practice that we learned is sort of you need 2 weeks ahead of that event to really get the word out, to get enough people to show up to get the vaccines. And in terms of incentives, it's all over the map. There are different public health officials that will say that they work and others that will say that they don't work. And I think we're at the point where you just have to try everything to get the remaining folks vaccinated.
Will you be at the Chicago Marathon?
I don't think so.
Okay. Well, that's a lot of people from all over.
Yeah, here's another thing I'll say about vaccine events is that a lot of times the successful ones are at like events that are not about vaccination, but are about getting other resources. So a lot of food pantries will just have vaccines available at the food pantry, or there will be job fairs, right, where people are coming in to get information about jobs, and you could also talk to someone about vaccination. Vaccination is a polarizing subject, and so like thinking of incentives as being beyond just for vaccination, but bringing people into an event about something else and then having vaccines present is a strategy.
I have so many questions, but I know I already asked one, but since no one else is jumping in, I'm just going to ask another one real quick. So I guess it's maybe a two-parter. The first one is, because we're all like comms nerds on this call, I'm just curious, like what you've learned about operationalizing internally. Like, are you using Slack? What tools are you finding that's been the most useful for you all to be mobilized, especially with information changing every minute? And I just can imagine that must be, gosh, a Herculean task. And my second question, which has nothing to do with the first one, is, we're all thinking about this, as we said in our intros, about our own organizations, our own audiences, our communities we serve, but what can we do to help you help your mission?
Okay, so in terms of like internal communications tools, our organization uses Teams. It's a good way to like be able to quickly chat people. It's integrated with the Microsoft suite, but the most effective way to share information are regular meetings. And so the Chicagoland Vaccine Partnership has a bunch of funders. It's staffed by this organization called Partners in Health. So I'm an employee of Partners in Health. They're a global healthcare organization that kind of came into the US and established a presence around COVID because we have a lot of contact tracing experience. And we sort of do like a weekly update call of all staff from all of the different sites across the US. I think we're in 11 different cities. Well, don't quote me on that, but we're in several different cities. And it's a place where like our basically epidemiologists share, here's what's going on with the disease, and people at each site share, here's what we've been trying, here's what worked, here's what hasn't. And so it is just sort of like regular face-to-face over a screen engagement to keep people up to date. And in terms of what you can do, talk to your families and friends about why you got vaccinated. That's the most effective thing. And if you want to, you can share out like that at-home vaccination opportunity with the staff at your organization, just in case people haven't heard of it and they might take advantage of it with financial compensation.
Anand, this has been really very, very helpful. I'm familiar with Partners in Health and the partnership that you all have. And I'm wondering, as far as the media is concerned, so have you considered the kinds of stories that are missing from the news cycle? Have you considered those in pitching the Tribune and the Sun-Times and others?
But when you say the types of stories that are missing from the cycle, do you mean stories about communities of color?
Stories about communities of color, and particularly when it comes to vaccine hesitancy. I think that sometimes we kind of stray away from even discussing that because we certainly want people to take the vaccine. But I think that, and I don't know the media strategy behind this, so forgive me if you've already considered this, but I think being able to demonstrate how folks have transformed in their thinking, I think that's more of a transparent approach to convincing people to take the vaccine. Because a lot of times, and we've learned it, I've learned this only through the listening sessions Public Narrative has had around folks and their interest in the vaccine, their hesitancy to take it and that sort of thing. And much of it comes from folks not being certain of what the city is not saying, the state is not saying, the government is not saying, and then learning of all these things after the fact. So 1 week Johnson & Johnson is not safe, now it's okay to take 2 doses. Like, what the information is not quite lining up for people. So my question then is, like, have you all considered capturing those stories of people who initially they were, anti-vaxxers, and then eventually they became ones who considered, it had a change of heart for various reasons? Like, I think that's the type of story that's missing, but I'm most interested like in what Made to Serve may have found. And of course we can talk offline more about this, but is there anything that you've noticed in the types of stories that are missing from the cycle?
Yeah, that's a great idea. And I would be happy to follow up to strategize more around media outreach. I would say that yes, like, I think that the story of the historic mistrust in like the Latinx and the Black community of the healthcare establishment is one that I haven't seen so much, but it probably is a huge part of why we're at where we're at with vaccines. Like I'm on calls sometimes with our grantees where they'll say that they got vaccinated, but they drove out to the suburbs, right, to get vaccinated because they didn't trust that what the government was providing in their neighborhoods would be as effective, because historically, right, there just hasn't been an investment in the south and west sides of Chicago. So yeah, I think you're right that that's a very compelling story, and yeah, I'd love to talk more about it.
Awesome, thank you.
Anand, there's some questions in the chat and comments in the chat.
Oh, sorry, yeah.
Laura asked, is there any sense about whether the company mandates increased vaccination?
I honestly don't know the answer to that. Most of our partners are sort of nonprofits. My guess would be that a mandate to get vaccinated if you work for a company would work because you'd want to keep your job, but I don't have any data about it.
Thank you.
Yeah, and I think, yeah, there's confirmation of Jamira's idea in the chat. And Yanira is saying that the most convincing strategy, the number one strategy in answer to Lynn's question, was when you have somebody who they trust who's kind of giving their own story of why they're taking the vaccine and what their basically vaccine conversion story was. So even within your trained pool, you may have a bunch of spokespeople that would fill that need that Jamira is talking about. You know,
I have an idea. Here's an outreach program that might be interesting. We have a huge number of professional communicators in the city of Chicago. We also have professional associations like PRSA and IABC and PCC and young professionals of PRSA. Why not reach out to professional communicators and say, take on a project and educate your constituencies and do training programs, and you do a training program for them so they can do pro bono work either for their clients, their organizations, or take a stand as we are professional communicators. And this is our turn to give back, to empower our audiences and constituencies, and let all the professional that you can also do for your organizations and you as professional communicators.
Yeah, it's a great idea.
And Jay is saying that there sounds like a great idea for StoryCorps vaccine, but vaccine hesitant people talking on StoryCorps. And they would make very good speakers for the project that Lynn's talking about. It's also super great social media content. You could post, Humans of New York type stories about vaccine conversions on Instagram. That'd be very powerful. And
yeah, because you know what? Because the few stories that I see about people who were anti-vaccine and they turned around is only because of a death in the family. That's the only time that I see it. So it's an extreme situation where there were no return, like no health, right? So if we can get people like, I was anti-vaccine, I saw the light, I got the vaccine, we saved my family, my kids are safe, my kids are now in school, that maybe we don't have to go all the way to the other end where people died for people to say, hey, I woke up. That maybe there's another way to do it that captures them earlier on in the process and they can become advocates. Now it's hard. I mean, I know how many people who are lay people are even willing to say my name publicly, but maybe I'll bet there's some good people out there. It's just a matter of tapping them on the shoulder.
Yeah, and some of our grantees are sort of more focused on social media campaigns. So one of them is a Black Film Festival that's sort of working to share stories of why people got vaccinated. I don't know if it's like people who were hesitant to pro-vaccine style story, but sharing those stories on social media. We've got some folks, like particularly in the violence prevention community, that have connections with like local rappers to try to get them to post on their social media about it. And yeah, I think that that's a great avenue to reach people.
Yeah, I want to circle back to Lynn's question about what we can all do to help you. You know, how can you know, taken from your strategies, how can we as communicators help you?
Yeah, I think that it's really sort of sharing opportunities where people can get vaccinated, talking to people in your networks about why you got vaccinated and why they should get vaccinated. And then for sort of the long-term public health piece, you know, we really are trying to increase the capacity of nonprofits in the South and West sides, particularly ones that are Black or Latinx led. And so, you know, I can share a list of our grantees after this and just kind of take a look at it. A lot of them are smaller organizations that do great work, but they don't have the communications capacity to share their stories. And, you know, I'm sure everyone on this call could, you know, help them write a case statement or you know, do some messaging about why their work matters. And I think building the capacity of those organizations is really how you reach those communities.
Yeah, I just wanted to follow up on that and something that Jay had said earlier too. I think that, of course, your focus now is on getting the vaccine, you know, throughout Chicagoland, but I think that the partnerships and coalitions, you know, the working relationships that you're building through this project will serve you well and serve us well in the future, you know, as we continue to try to address the health discrepancies throughout the city.
Oh, here's another idea. I'm a member of Women in Bio. We have a very, very active Chicago chapter. I'll bet they would take on to like, and I'm an idea person. I wake up in the middle of the night. Women in Bio, Chicago chapter. They're all women scientists committed to doing good, advancing science. They have a broad reach of members, but also narrow in the sense that they typically are, you know, PhD type people. On the other hand, they do a lot of really good work in the community and encouraging people to get involved with science and girls early in their lives. So there's a whole outreach program, mentors, mentees. Secondly, like I put out a weekly newsletter with all my job openings. So I'm always happy to promote the resources that you have available. If you want to reach out to me, we can talk after. Happy to do it.
Yeah, of course. Just put your email address in the chat here and I'll follow up with you.
Actually, if anybody here puts out a newsletter and you can include a link to links to these resources, that would be, you know, kind of universally helpful. I see a couple of questions in the chat, and I know Anand, this workplace isn't really your bailiwick, but I'm just wondering if anybody else on the Zoom has experience with messaging across your company. I see Laura has a question about internal communication. Laura, did you want to ask your question?
Yes, I just think, you know, in some organizations, you have a group that's all shares the same views, but in others you don't. And so I'm just wondering if anyone's done anything with a workplace where people have strong views on both sides, and you know, leadership would like people to be in person, collaborating.
Has anybody is anybody here been in person in their office? Has anybody gone back to in person?
I've had 2 really small meetings with executive team, but we're not back at the office yet. So we've done it all but that it wasn't about addressing vaccination. It was about something, you know, about business as usual stuff. But we aren't going back to the office officially probably till January, if not later. I'm sure many of you are in the same boat. Right? Yeah.
Thank you. Yeah, I think you know, some companies are feeling that people are getting tired with Zoom and there's like not as much productivity, and so they really want people to get back together face to face. But you know, if someone wants to wear a mask and someone doesn't, and you're in the same space, it just seems difficult to navigate and keep relationships strong.
Yeah, well, I think that this is a sticky wicket. You know, I went to my gym this morning and, you know, working out, and there's like, you know, one member of the gym who refuses to wear a mask. And so everybody's not going in that room because that member's in there working out and won't wear a mask. You know, it's like, you know, complicated.
Thank you.
Well, if we don't have any more questions for Anand, I have a question for everybody here. So, and we're talking about in-person stuff. So ComNet is having their conference. Kareem, what are the dates again? October 9th?
It's October 6th to October 8th.
Okay,
so
6th to
8th. Thursday and Friday.
So yeah, it's a little bit iffy weather in Chicago. But, you know, we were thinking, wouldn't it be great if we just had an in-person social gathering during the conference, you know, one of the evenings, a little cocktail party. We did try that this summer in July. We met at Revival Food Hall, which is a very big open space downtown Chicago, has a bar and has lots of restaurants in it. And we were, you know, just kind of gathering there, but it was clearly indoors. And so we're thinking we could do something like that in person, or we can use one of the formats for kind of networking that ComNet has set up virtually. And we're just wanting to kind of get a read from, you guys are our focus group of membership. What do you guys prefer, in person or virtual? All right, show of hands, how many people prefer in person? And how many people prefer it virtual? All righty, then we will explore those different platforms for virtual. Kareem, can you just give us a thumbnail of, I saw like some different kinds of networking platforms in there. Can you just briefly tell us what the different choices are, and we can get a sense of what people are interested in doing?
Yeah, well, the one that was pitched was Gather Round. So that's kind of a nice thing. I mean, generally, Sean wants people to engage with other folks in town, not in town, in your area, right, that are at E21. So it would be sort of a mix between something like this and also a way for people to introduce themselves and meet other people who are interested in comms and being part of ComNet. I can forward the information because I don't want to, I don't think I have them all at the top of my head, all the options, but.
Okay. So sort of like that Sonic one that our ComNet chapter did an event on Sonic where we had, you know, deck chairs on a yacht, and we had a lounge, and people could move their avatar around and talk to people. Is it sort of like that?
Yeah, I mean, I think what was suggested was a little more basic than that because, you know, not everybody's as tech savvy as you are, Jennifer, with that type of gathering. So I think they set the bar low. But of course, if you wanted to do something more engaging or fun, I mean, that sounds great. I had a fun time when you did that before. But I think in terms of everything that's going on, there's just not a lot of support to help if something happens or you need help setting it up, since everybody's focused on the conference. So it's whatever you're comfortable with. You know, I think yeah, whatever you want to do. Of course, we can help in the beginning, but during the event, we probably won't be able to.
We don't need to add to your plate. So Jackie, you have your hand up. Did you want to say something?
Oh no, that was the vote that we all did. Just stayed there. But I have to go. But I do want to thank everyone for joining, and thank you, Anand, for your time and for your incredible work with the CVP.
Thanks, Jackie.
Bye, everyone.
We've hit our hour. So the ComNet organizers will kind of figure out what we're going to do during the conference. And of course, everybody here is invited, even if you're not registered for the conference. Sorry, Kareem, but we'll keep it open to our community. And we'll send out a notice in the next couple of days. Okay. Thank you. And thank you, Anand. This is really, really fantastic, really great information. And thank you for your generosity in putting this all together for us and sharing with us today.
Of course. Thanks, everybody.
All right.
Thank you so much.